Hello and welcome to another edition of Tuesdays with a Disability Policy for All. Today I had the great fortune to be talking with Julia Oppenheimer, who is an AUCD children mental health champion. I'm excited that we'll be learning about her children's mental health project today. Before we get started, I will visually describe myself, and then Julia, you can do the same for the audience. I'm a white woman with black hair, with silver glasses, green flowery blouse. So Julia?
Hi, thank you so much for having me. I am a white woman with long brown hair, and I'm wearing a blue and greenish scarf and a black shirt.
Thank you. And again, welcome. My first question is, what is the difference between children and adult mental health? And why is AUCD focusing on children mental health?
That's a good question, Liz. Children's and adults' mental health are both so important to all of us, and something that we've been growing in our awareness of and are talking about, I think, over the past 2 years, even more than before that, with COVID and people feeling more isolated. One of the reasons that AUCD is focusing on children's mental health right now is that we're coming up in May, from May 1st to 7th, on Children's Mental Health Acceptance Week. It was previously Awareness Week. The difference between children's mental health and adults' mental health is that adults have more power to advocate for themselves, or to go to their doctor, go to their friends and say, I'm not feeling great, I'm feeling depressed. They can get themselves into therapy and they can talk about what's going on with them. Kids don't always have those choices, and they don't always have the words or the understanding to say what's going on with them.
Thank you. What is your project and how will it support children mental health?
Our project is called the New Mexico ABC project, and we are working with a team. I'm the person on the team who is the expert in infant mental health and early childhood mental health, but we have a team of psychologists and social workers and psychiatrists, and we want to do outreach to or share our information with pediatricians and family practice doctors around the state of New Mexico. So I live in Albuquerque, New Mexico, which is a big city in New Mexico, but not necessarily a big city by other states' standards. And we're in the middle of a very rural state, which means it's a state where there's lots of land and not that many people living on it. And we have a lot of very small towns where there aren't a lot of doctors, there aren't a lot of therapists, or people who have specific training. So we know that the children who live in those areas, the main person that they're seeing for any kind of help, whether it's their physical health or their mental health, is going to be their doctor. They're going to go to them with everything. So we want to help train those doctors to be able to recognize when there's mental health concerns in very young children.
What is a support group and how do they work?
These doctors and nurses are working in isolation in a lot of ways. So they're really by themselves. They may be the only doctor in 60 or 100 miles. And so they don't have anybody to talk to about what's hard or what's going well. And so we want to create support groups for these doctors through this training so they can see other people are having the same experiences as them. And so by support groups, we're thinking kind of building relationships, building friendships between people doing the same thing in different areas.
Thank you. And you said isolation, like being lonely.
Yeah, being like all by yourself, and sometimes it's actually being all by yourself, and sometimes it's just feeling like you're all by yourself. You're the only one having this experience, and that's really hard for grown-ups and for kids.
Before we end, is there anything else you would like to share with the audience, Julia?
Yes, it's the New Mexico ABC project. That stands for the New Mexico Access to Behavioral Health for Children project. And it's actually a project funded by HRSA for 5 years. We're just in the very beginning of the project through their pediatric mental health care access programs. So we're very grateful to have that funding as we move forward this.
And just for our audience purposes, HRSA is an organization that AUCT works with and partners on different projects, and your project is one of them. So thank you, Julia. This has been a really wonderful conversation about mental health and children. I know I learned a lot, and I hope the audience has too. And thank you, Julia. And I'll see you next time.
Okay, thank you
Bye.
so much. It was great to be here.
Bye.